Did you hear about the dirty Easter egg hunt? It was hosted by the Dust Bunny.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Your show was better when you had medical questions. Hey!
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the wacko alternative medicine assholes. This is a show for people who had never listened to a medical show or a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Oh, God. Don't act on anything you hear on the show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. Don't forget stuff.drsteve.com. That's stuff.drsteve.com for all your Amazon needs. And check out Noom, Noom, at drsteve.com. If you want to lose weight with me, I'm basically very close to my ideal body weight and have been for the last 3 years, thanks to Noom. It's not a diet. It's a, what would you call it? A psychology program. Helps you change your relationship with food. Get 2 weeks off, 2 weeks free and 20% off at noom.drsteve.com. And check out, if you have back pain and you ever wanted to try an inversion table, check out the one that I found at backpain.drsteve.com. On this one, you got to spell out doctor, D-O-C-T-O-R, steve.com. Well, don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And you still going to wrap it up, or you're going to hang in there?
I was going to say, get it down before it gets gone.
Really?
Yeah, I am. Yeah. Retiring, man. I'm slowing down.
So now what are you going to do? I know we talked about this last week. You know what?
Not much.
Nobody gives a shit.
No, they don't.
All right. Let's just, last week we did a lot of bullshitting, and we got a bunch of this.
Stop bullshitting and get to the questions.
God damn, this
okay, I got it.
Boring as sex with my wife.
Gotcha. So we're just going to do 1 million
questions there.
Voicemails.
Cool.
Probably 1 million minus 999,996, but that's all right. We'll get close.
Something like that.
All right. So let's. First we got to get the most important disclaimer.
Number one thing: don't take advice from some asshole on the radio.
Thank you, Ronnie B. Absolutely true. All right.
Hi, Dr. Steve. This is Barry from California.
Hey, Barry.
I had something interesting happen a few days ago, and I was hoping to get your take on it.
Okay.
I live in California, so it's a medical marijuana or a recreational state, legal state. I've been smoking weed for about 5 or 6 years. So my normal use is I'll smoke a joint or even do some edibles like in the evening after work, after dinner. Probably about 4 or 5 nights a week.
Okay.
Or on weekends. So I'm a regular consumer of weed and have been for a number of years. So I have had periods of time where I've quit weed for days at a time, like if I'm on a business trip and I'm in a foreign country and I don't have access to weed, I never experienced any kind of withdrawal syndrome or anything, not physically. I never got sick, but there would be times when I'd feel like I really wanted it psychologically when I couldn't get it. So that's the extent of my withdrawal that I've had for that. But that usually happens if I go without weed for a number of days, just a couple days or even one day maybe. I'll feel like I want to smoke some weed.
Sure.
So I have had a bad back, some back pain for a few years now, and my doctor, after an MRI, decided that it might be related to nerve pain. I'm going to go see a neurosurgeon pretty soon, I think, just to talk to them about it. She prescribed me Gabapentin. This was 5 days ago.
Oh, I bet I know where this is going.
I've never taken Gabapentin before. So I took 300 milligrams at night. That's what she said, just that. And after the first time I took it, the next day, I didn't want to smoke weed anymore. I really lost my taste completely.
Give yourself a bill.
I have some right there. I can see it. It's sitting right there. I don't want to smoke it. And that was 5 days ago. And I have not consumed any weed at all in 5 days. And I've been taking 300 milligrams of gabapentin each night. And that's when it started. Weed actually seems kind of distasteful to me now. And it's kind of hard to explain.
How sad.
I don't really want it anymore. Is this because of the gabapentin? It can't just be a coincidence.
Give yourself a bill.
Yeah. So I let that go. It was a pretty long phone call, but it's pretty interesting. So we got a guy that is a regular, habitual user of marijuana. When he doesn't use it, he wants it. Not a real physical withdrawal, but he feels that he wants it.
Right.
Craving it would be another word for it.
Probably.
Yeah, whatever. I mean, craving. I mean, it's all, everything's
related.
in our head, right?
Sure. Well, that's a damn
and then he took gabapentin. Now he didn't give two shits about it. So I did some research on this, and gabapentin is an interesting drug. It's prescribed as an anticonvulsant, or it was, but I have to be honest with you. If you know anybody that has been prescribed gabapentin for seizures, then you know, if you know one person that's had, you know one more than I know.
Yeah, no, zero.
Because we've used it for neuropathic pain for quite some time, and sometimes it works, sometimes it doesn't, but it does act. It resembles this neurotransmitter called gamma-aminobutyric acid, or GABA. And what that does is it regulates the excitability of the neurons in the central nervous system. And cannabis withdrawal, and when I say withdrawal, I mean not taking it. I'm not talking about going through like cold turkey like you do with heroin or something.
Yes.
But when you withdraw it, you get an overactivation of these same stress circuits that are, and it's actually similar to alcohol withdrawal, even though the effects are completely different.
Sure.
So this has been tested, and that's why I gave him the Opie Bell several times, because there was a study in 2008 where they recruited 50 pot users, and these were people who actually wanted to quit smoking but were having trouble because they wanted it. And they gave them 1,200 milligrams a day of gabapentin, which is a moderate amount. The max dose is around 3,600. So in a normal person with normal kidneys, so this would have been 1/3 of the maximum dose. And then the other 25 took a placebo. Excellent. I'll give them this.
Give yourself a bill.
And they monitored them over 12 weeks. Now, this showed that the gabapentin subjects had a much higher success of staying off the pot. So it seemed to block that craving impulse that was in the brain. It reduced sleep disturbance, drug cravings, unhappiness, and some even showed some evidence of improved cognition, meaning that they really, I mean, that the way they test that is to have you remember groups of numbers and then recite them backward and stuff like that. So it's really interesting. There are these self-control related circuits, and they can be weakened. Mine are weakened when it comes to things like peanut butter on rice cakes, which sounds like it shouldn't be a big deal, except when you eat like a whole pack of them, then it is a big deal and you can't stop. So I have weakened self-control circuits when it comes to things like that because I've been on this diet, this lifestyle for so long that every once in a while I crave something else. So I just don't buy that stuff. But if I have it, I'll, by God, go for it. Right on. And it's the same thing with pot. That's why cigarettes are such a difficult addiction to beat because it's so readily available. Mm-hmm. Even some drugstores sell them. Not all. Mm-hmm. Some of the chains have said we're not going to sell tobacco anymore. That's why, I don't want to talk politics, but that's why Al Gore lost the presidency, by the way.
He didn't smoke pot?
No. Well, yeah, the whole, I tried it, but I didn't inhale. That was his boss.
Well, yes, I remember.
But, no, Al came here to Tennessee and told, had a rally and told the tobacco farmers, don't worry about it, I got your back. Mm-hmm. And then went to the convention, or not the convention, the convention.
The national convention.
The national convention was like, tobacco's bad. We got to get rid of tobacco. And the tobacco farmers in Tennessee went, what the hell? Yeah. And they mounted a pretty massive campaign against him, and he didn't win his own home state. Of course, Al really never was from Tennessee. He's from Washington, D.C., but anyway.
No.
So, I told people at the time if Gore had just won his home state, he would have won because that's how close it was.
Hanging Chads?
Yeah, we went to Hanging Chads in Florida because he didn't win his home state.
That should tell you something.
Yeah, I guess. I don't know. That was a long time ago, so I don't figure too many people get mad about what I'm saying at this point. But
no.
So they're doing larger studies to confirm gabapentin in helping people who want to quit cannabis, quit it. But this guy points out a phenomenon that is known in the medical literature, that gabapentin has some effect on the craving of cannabis.
Interesting.
So, very interesting.
Because we do see people on gabapentin every single day, all day long for nerve pain to varying degrees of success. But, just out of curiosity, and I'm going to look it up here in a minute, I wonder if they've ever done any kind of research on it, gabapentin and alcohol withdrawal. Trying to get someone who's a profound alcoholic, maybe coming up with other solutions to incorporate with alcohol. I don't know. I'll look it up while you're.
I'm looking it up right now.
Because alcohol addiction is profoundly difficult to treat.
Gabapentin looks like it has been studied. Let me see if I can find this. This is just some RIA Health website.
Yeah, sure.
That's pushing it. I'm just looking. Okay, here we go. One study compared gabapentin to placebo. Patients who received placebo had an abstinence rate of 4% compared to 17% that took the 1,800 milligrams of gabapentin. So the efficacy was still pretty low, but there were 3 to 4 times, well, it was 4 times more people quit alcohol taking gabapentin than took the placebo.
Wow.
Now, I don't know how powered this study was and all that stuff. Okay, here's a 2007 study found that compared to placebo group, those who took gabapentin significantly reduced their heavy drinking and number of drinks per day. They also increased the number of alcohol-free days. It says people who hadn't reduced drinking while taking naltrexone. So naltrexone is an interesting drug. It's a mu opioid receptor blocker, but it also helps because we have those receptors. Okay, mu opioids are like morphine, Dilaudid, which is on the street, aka hydromorphone. Those things are mu opioid receptor agonists. In other words, they stimulate the mu opioid receptor. So morphine. I get hydrocodone, Dilaudid,
fentanyl.
Fentanyl. Now, Percocet does, but also Percocets do the kappa receptor as well. And then methadone does the mu and delta receptors primarily. And so that they have slightly different effects. But anyway, Naltrexone is a mu opioid receptor blocker. You say, well, alcohol doesn't stimulate the mu opioid receptor, so why would that work? Well, because why do we have mu opioid receptors? It's not in case we take a Percocet. Mm-hmm. It's because we make our own endogenous, in other words, inside our body, opioids ourselves.
Right.
Okay? And so when we make endogenous opioids, they bind to those receptors. Mm-hmm. And those receptors are deep in the brain in the pleasure center.
Sure.
And so alcohol likely stimulates some endogenous opioids that stimulate the pleasure centers, and when you block that, you don't get that pleasurable feeling when you drink, and you will have less of a craving for alcohol. That's the hypothesis, and it does seem to work.
Right.
So what they're saying is that people who didn't do very well with naltrexone may respond better to gabapentin. So there you go.
Cool.
Well,
something to know.
Yep. Okay, so it's not commonly used, but addictionologists may be using it.
Right.
All right, anything else on that? Okay.
Hey, Dr. Steve. How are you doing?
Good. How are you?
This is Lisa.
Hey, Lisa.
Beaufort, Georgia.
Woohoo. Yay.
What does doctor refusing TAVR have to do with an MMSE of less than 12?
Okay. Wow, this is a really packed question.
Or that does TAVR make cognitive impairment worse? Thanks, Dr. Steve. Hope it's an interesting question you can do on the podcast. Bye. Yeah,
so let's talk about TAVR first. So TAVR is trans-aortic valve replacement, or transcatheter aortic valve replacement. It's a less invasive way to replace an aortic valve when people have what we call aortic stenosis. So this would be people who have a valve that's too narrow and they're not able to pump enough blood out of their heart, or it is being pumped out under high pressure. So now, so what she was saying is that this person had an MMSE of less than 12, and that's a mini mental status exam. That's a sign of pretty severe dementia, because you and I would score a 30 on that. And that's if you can do serial 7s. Can you do serial 7s, Dr. Scott? What's 100 minus 7?
93.
What's 93 minus 7?
86.
Ooh, 86 minus 7.
79.
There you go. So very good. All right. We'll
give yourself a bill.
Serial 7s are hard.
They are, yeah.
And they pick that for a reason.
Sure,
now, you can do serial 3s, but those are much easier. But so the mini mental status exam looks at things like, can you draw two intersecting pentagons? Can you read a sentence and do what it says? And it's just basically, it says, close your eyes. Can you write a sentence with the correct punctuation? And can you memorize 3 objects? So this is one of the things that they'll do, Dr. Scott. I'm going to tell you 3 objects. You repeat them back to me.
Okay.
No, shit. See, I already flunked. Apple, table, penny.
Okay.
Say them back.
Oh, apple, table, penny.
Okay, now spell world.
WORLD.
Now spell it backwards.
DLROW.
Good, very good. All right. Give you one of those.
Give yourself a bill.
Now, what were those 3 objects I told you to remember?
Apple, table, penny.
There you go. See, so you would pass that part of the mini mental status.
That might be the only part.
But there are a lot of people who have short-term memory stuff. As soon as you distract them, that's what that spelling world backward really is for.
Sure. Yeah.
Is to distract. I mean, you get points for it too, but it distracts you from that short-term memory register. And if you have bad short-term memory loss, you won't be able to bring those up. And then I'll ask you, what's this thing on my wrist?
Right on.
What is that?
Wrist watch.
Okay, so it's not, if you answered, it is a thing that tells time.
Yeah.
That's a sign of a disorder called anomia, where you lose the ability to name things. I had a professor in medical school who had and I've talked about him on this show before, who had an IQ of at least 220. I mean, the smartest person I've ever met.
Jeez.
And when he got some dementia, he would describe a deck of cards. He couldn't come up with the word deck of cards, but he would say a concentric stack of thin laminates. Now, that is a damn genius with stage 1 dementia,
Gosh.
Isn't that crazy?
That is crazy. Oh, my God.
That is a concentric stack of thin laminates. Pretty fascinating. So
that is
anyway.
pretty wild.
So anyway, so this person has a MMSE of 12, which means that they got a lot of stuff wrong on that.
Right on.
And then they're asking, why would the docs decline to do this TAVR on that person? Mm-hmm. So, baseline depression is linked to poor outcomes.
Sure.
But when it comes to dementia, I had an article here. Let me see. Okay, dementia in TAVR patients raises several risks, but not mortality. So, among patients undergoing transcatheter aortic valve replacement, a history of dementia is associated with higher rates of in-hospital delirium, which I can attest to this. There are 7 stages of dementia according to the FAST scale. And it starts with just having a little bit of trouble organizing things all the way to being curled up in a ball, just going la, 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 la all day. And with that being stage 7, you can bring some people in with stage 1 or 2 dementia, do a procedure on them and stress their body, get those stress hormones going, and it kicks their brain into stage 7. And some of them come back and some of them don't.
Yeah, and Dr. Steve, doesn't that have something to do with the anesthesia when they...
I've seen it even when they do spinal anesthesia for like hip fractures and stuff like that.
Okay, not necessarily just a general.
But they do use some other sedating medications though, so it could be that. So they have longer hospital stays and greater chance of discharge to a rehab facility. And this was a nationwide cohort study that compared 3,000 pairs of TAVR patients with and without baseline dementia. Was done researchers at the Cleveland Clinic, so it's a pretty good one. There's really a dearth of data on TAVR and dementia, and if you have severe symptomatic aortic stenosis in people older than I am, there just isn't a whole lot of data on people with dementia, whether it does them any good or not.
Okay.
But if they have severe symptomatic aortic stenosis, so what would your symptoms be? You'd have congestive heart failure is one, fainting is another one, chest pain is another one. That's sort of the triad of severe stenosis of the aorta that says these people have a 1-year mortality that's significant.
Yes.
And so in this case, if the patient is really not functional at all, the surgeons may have just said, look, they're not functional enough for them to realize an improvement from this surgery.
Right on.
I would want to know how symptomatic they were. Are they symptomatic at rest? Are they able to get up and do stuff on their own? Because when you got a mental status exam that's that low,
they may not be doing much of anything.
They might not be doing much of anything, and so the surgeon may have felt the risk outweighed any possible benefit they could have had.
Right.
But there's not a hard and fast rule on that.
Right.
So these authors of this study said that they encourage incorporation of cognitive function into the standardized workup for patients considering TAVR. And society guidelines recommend factoring in cognitive status. Standardized score threshold has not been established and would require more study. So that was just the surgeon themselves just saying, hey, I'm doing an overall risk analysis, and I don't think this patient's going to benefit from this, which is good. They're not knife happy.
Yeah, yeah.
But it's relatively safe in patients with dementia in general.
Right.
It's just there are some risks. All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Hey, Dr. Steve. How you doing?
Hey, I'm good, man. How are you?
Good. Hey, I have a question about herpes. I found out from my ex-girlfriend about a year via email that she had herpes the whole time we were together.
Okay. Yay.
Great news, I know.
Give yourself a
No, that's the wrong one. Oh, well, never mind.
Of the virus, especially in someone that is not showing symptoms. And I know there's HSV1 and HSV2, and they can live on different parts of the body. But I ordered an IgG test to see, if I have either of those, but it won't tell me where the virus lives.
That's right.
I'm just kind of curious what the prevalence of those strains are out in the population. Appreciate the show. Thanks for the answers as always. Thank you.
Yeah, thanks, man. Herpes simplex is common in the United States, so let's just talk about genital herpes. And we could talk about the differentiation between herpes 1 and 2. We haven't done that in a while. The CDC estimated there were 572,000 new genital herpes infections in the United States in a single year. So 12% of people between the age of 14 to 49, have HSV2 infection. And the prevalence is higher. It's really higher than that because an increasing number of genital herpes infections are caused by herpes simplex 1. So people usually get HSV1, that's the oral herpes, in childhood, and then you go blow somebody, and then you impart HSV1 to their genitals, and then they have sex with somebody else, and they impart genital to genital HSV1 sometimes. Okay. Herpes simplex 2 infections, weirdly more common among women than among men. And the percentage of those infected during 2015-2016 were 16% of women versus 8% of men among 14 to 49-year-olds. Isn't that interesting? And they think it's because genital infection is more easily transmitted from men to women than from women to men during penile vaginal sex. So,
okay.
So if you have just sex with random people, then you have between the age of, let's say, 18 to 49, the odds are, 12% that you'll be exposed to herpes. That doesn't mean that you'll get herpes.
No.
12% of the time. Now, if you're in a couple, there was a study done, just called Reducing the Transmission of Genital Herpes, and they had monogamous HSV2 discordant couples. In other words, one person had HSV2 and the other one didn't. 5% over an 8-month period, the transmission was very low. And now the reason for that low transmission rate, again, was they recruited women as the infected partners in 67% of the couples, because usually it's the woman that's infected.
Right.
And it is harder for the woman to give it to a guy than for the guy to give it to a woman. So, now getting your IgG won't tell you when you got it, who you got it from, or where it lives. IgG is just an antibody that shows a mature infection, that you're producing antibodies, which means you were exposed to that antigen. You can do a herpes simplex 1 and 2 serologic test and see if you've ever been exposed to either one of those. If you have antibodies to them, you've been exposed. Doesn't mean you have outbreaks. And, there are lots of ways that people can reduce the risk of transmitting it from one person to the other. One thing that you can do is using valacyclovir. And valacyclovir is a herpes-specific drug that will reduce the duration of a herpes outbreak if you get it, but it will also help to prevent outbreaks if you take it every day. Some people recommend lysine. I still haven't seen a double-blind, placebo-controlled study that shows that lysine makes any difference, but I hear about it a lot, that people who had frequent outbreaks who take lysine every day have fewer outbreaks. Now, the hypothesis on the mechanism of that makes sense. Just because it makes sense doesn't make it true.
Right.
But herpes, when it assembles itself, has to assemble its coat out of arginine. So its coat is polyarginine. Arginine is an amino acid, and it links all these things together to make its coat. And lysine will compete with arginine at the level of the enzyme that builds the coat. And so if you have a lot of lysine and the balance is more lysine than arginine, the hypothesis is it's hard for the herpes virus to make its coat, so it just gives up and says, oh, fuck it.
Yeah. I'm tired.
Yeah, can't do it. Now let's talk a little bit about HSV1 and HSV2. These things show trophism, which means they like to live in certain parts of the body. So HSV2 loves to live in the genitalia. HSV1 loves to live in the oral cavity. Why? I don't know. They're just different. I mean, why is the tip of your dick different than your ear? They just are. I mean, they differentiated when you're an embryo, and so they're different. And there are different proteins and different signaling mechanisms and those things, and so the herpes virus loves to live down there. It can attach there easier, but it can live in the mouth.
Right.
Likewise, HSV1 loves to live in the mouth, but it can live on your genitalia, or more specifically, the nerve endings or the nerve ganglia that feed the genitalia. That's where it loves to live. So, but when you they live there uncomfortably. So if you have herpes simplex 1 on your genitals, you're more likely to have a less severe outbreak and less frequent outbreak. And you may even get to the point where you don't have outbreaks at all. Likewise, if you have HSV2 in the mouth.
Okay.
But people think, well, HSV1, that's the oral one. That's the quote-unquote good one. And it's not the good one, because when you have herpes encephalitis, which is an herpes infection of the brain that can cause delirium and even death, that's almost always herpes simplex 1, and that's almost always because of its proximity to the brain.
Right.
So HSV1 isn't the good one.
No.
It's the goofus and gallant relationship between HSV1 and HSV2 for those of you highlights readers from the past. Do they even have that anymore?
I don't think so.
Let's look up goofus and gallant. Because I remember I would always read Goofus and Gallant.
That's got to be old.
It is old, but I wonder if they still do it, though. Okay, here's 12 times Goofus from Goofus and Gallant was the absolute worst.
There you go.
So someone has actually done a web page. You think Goofus would have developed some manners by now. And let's see. So Gallant says, I wish I had a little... No, I'm glad I have a little brother, but Goofus says, I wish I didn't have a brother. Okay.
Oh my gosh.
Let me see. That's not that good. Okay. And then, you can tell from the mother that she's just totally fed up with Goofus, because he says, let me see it. Oh, how evil. They have a bunch of what looks like just playing cards on a mat, and Goofus, because he's an anarchist, just says, let me see it. But Mom wants to control these kids.
Okay.
And she's a control freak. She's a totalitarian. And she has a big smile on her face when Gallant says, may I see it, please? So this is it's a control issue.
Scandalous.
Yeah. Let me see. Oh, Goofus uses his book with dirty hands.
Ooh.
But Gallant has clean hands when using a book. You don't use a book, you read a book. But anyway, he's holding his hand up, and the light is shining off of it. Okay, let's see. Okay, this one, here's a woman that looks horrified because Goofus says, "My, you have nice things in your purse." Okay, but Gallant says, "Here's your purse, Mrs. Green." What a little shit. I always hated Gallant. Now I know why. Okay, let's see.
All right, we better get back to the questions.
What was the question? Wait.
About herpes.
What, am I boring you?
No, maybe everybody else.
Okay, well, okay.
Gallant and Goofus. You could look those up if you'd like.
Squirrels are scared of Goofus. That's so he's bad because squirrel. Have you ever had a squirrel that wasn't scared of you that didn't have rabies?
No.
Squirrels eat from Gallant's hand and then bite him and give him rabies.
Well, there you go.
Yeah, this is all about control.
Yep.
Goofus grew up liking Rage Against the Machine, and F you, I won't do what you tell me. That was Goofus.
Oh,
and you know what? That's way cooler than that guy who told you if you go to San Francisco, you should wear flowers in your hair. Who would you rather hang out with?
The flowers in the hair, man.
Are you serious?
Oh, for sure, yeah.
No. You're silly. All right.
Back to herpes.
Okay, so back to herpes. I bet Gallant has herpes.
I bet Gallant has herpes.
He has
not the good herpes either.
No, he has the
bad herpes.
Yeah, he's got the bad kind. But Goofus is making fun of him. That's what it is. He's like, "Ha ha, you have herpes. Ha!"
Mm-hmm.
"Don't make fun of my ailment, Goofus," says Gallant. All right. So herpes. I don't even remember what the hell we were talking about. I think we were done with that, actually. Were we not?
I think so. I think we've answered the difference between the herpes and...
There you go.
Yep.
Hey, Dr. Steve. It's Matt in Charleston.
Hey,
How
Matt.
are you?
Good, man. How are you?
That's good.
Good.
I'm doing great.
Cool,
hey,
man.
Fumia was on Rogan last week, and he mentioned that he is moving to South Carolina.
Yep.
And I remember that you also mentioned you are moving to South Carolina.
Yeah, completely independent thinking.
Not great minds thinking alike.
No, it is great minds thinking alike, but it's totally, that's what it is. It's not one of us said, "Oh, I'm moving to South Carolina," and the other one said, "We're moving to South Carolina." Not that I would influence Sir Anthony or Professor Anthony in such a way. But we're both moving to South Kakalaki eventually.
Sometime in the future.
Yep.
Does that mean that you guys will be doing some sort of collabo, more so radio type thing? All right. Cool. Not really a medical question, but just curious. Thanks.
Yeah, where he's going to be living will just be not that far from me because we'll be in the same state. I mean, it's a big state, but I think I know where he's going to end up or in the general vicinity, and where I'm going to be living will be about an hour and a half away if I'm right. So that we've talked about it. We've talked about it doing it now, but I'm with the laugh button and all that stuff. But when I do Dr. Steve Unbound, whenever that is, when these freaking gloves come off because I'm employed and I actually care what people think about me, when I no longer care, I've got some shit to say and I will, by God, say it. So I'm looking forward to either Weird Medicine Unbound or Dr. Steve Unbound or whatever, and doing it at wherever I'm doing it. If it happens to be with my old buddy Anthony, then that would be awesome. But I'm still friends with everybody. I think I'm the only person left that's still friends with everybody up there. At least I think I am. Anyway, I hope I am. And it's going to be interesting. So yes, it's something to look forward to. But for me, maybe not you all, but for me, this is one for you, Dr. Scott.
Hello, Dr. Steve. I hope you're well.
Thank you.
I miss Tasty.
Yeah, we do too.
Hey, Scott, got a two-part question for you. What does modern medical science have down pat? Absolutely solid. If it happens,
who's Pat? Sorry.
Know exactly what to do, no ifs, ands, or buts about it. And what is still a huge mystery to modern medical science that you all just still baffles everything. And
well, it's interesting that he's asking you this, but actually, I think that's good because you're looking from the outside. You see the things that we can't. I have some answers for this, but you see the stuff that we can't do because that's when they come to you is because we failed.
Right on. It's just a shot in the dark. Yeah. Thank you. Bye, Casey.
Thank you, Stacy Deloach.
No, I think it's a great question. And
KK4WZI.
I think modern medicine does a lot of things extremely well. For instance, if someone has a bacterial infection and you can identify that and give them a specific antibiotic for it, then I think it's wonderful. But let's talk about pain just specifically. Pain is something that I think modern medicine does extremely well, but I also think it fails miserably at. Same time, similar cases for different people because everybody is so uniquely different. Yep. There's a lot of times, Dr. Steve, you know as well as I do, a pain medicine used appropriately is an incredible thing. And a pain medicine used inappropriately is a horrible thing.
Yeah.
And
it's worse than doing nothing.
It's worse than doing nothing.
I agree.
It certainly is.
Or can be.
Yes, sir. And I think interventional pain medicine works extremely well. Doing proper shots in the right spot for the right people, but not because you're doing it because you're trying to, upcharge someone. I think is a
no, my buddy Paul has done 3 or 4 epidural steroid injections on me, and they've worked every single time.
Yeah, and it's very targeted. It works extremely well.
By the way, check out backpain.drsteve.com. You got to spell it all out, but
I can make this
for my most recent foray into a non-pharmacologic pain thing for my back. But go ahead.
Yeah, and you are doing better with that.
I'm way better
with your inversion table. But I'll make it really simple for you. Western medicine treats things that it can identify specifically extremely well, and Chinese medicine, what I do, treats things that are not identified well.
By Western medicine.
By Western medicine.
Yeah, you always have a diagnosis, even if we can't come up with one.
Yeah, so in other
even
words,
if we would look at it and go, what the F is he talking about? The third pulse.
Yeah, but somebody comes in with a bad stomach and they give them something, but you can't identify exactly what it is. You may not, and I'm not saying you, Dr. Steve. I'm just saying the colloquial term. It may not treat so well, but you might send to me and say, "Hey, man, listen, we don't know exactly what's going on.
Sure,
you have a shot at it." So, I think Western medicine.
Well, that's how you and I got together in the first place.
Yeah. So I think Western medicine has a lot of terrific advantages as long as they can identify it specifically, and that's one thing I really hate about what you do, is your hands are tied by insurance companies and by bosses, employers.
Yeah.
And you know a lot of things you could tell somebody to do that sometimes you can't tell them to do because of your restrictions. So Dr. Steve Unhinged may be a whole different Dr. Steve.
I can still get sued. I would not give medical advice, per se, without a disclaimer
of course.
on a thing. But there are things that I can't, like I can't prescribe marijuana in the state that we live in for a hospice patient even.
Right.
And I know that it would make them better.
Yes.
Now I can say, I think it would make you better, but don't tell anybody that I said that.
Right.
But that's
it didn't
bullshit.
come from me, right?
Yeah. That's rough. It's rough to. So there are things. Alan Watts said there's experiences you can never have. I can never touch the tip of my index finger of my right hand with the index finger of my right hand. That's not an experience I can ever have. And so there are things that I can't. It's a bad analogy, but it's just such a cool thing that he said that I can't ever do for my patients. Because either I'm not smart enough or we just don't know enough, or I'm constrained either by my corporate construct or by the law.
Right.
So, and those may be things that benefit people. Now, when Dr. Scott and I worked in the same office, do you remember how that happened?
Yes, I do.
You do? Okay. How did we get together?
Real quick, there was a physician recruiter at our hospital that said, "Hey, there's a great little spot down in this little country town, and there's a couple of doctors down there I think you would fit right in with, and we've got an open."
Do you remember that person's name?
I do. Rambo.
Well, okay. Yeah.
Yep. You know, like the Rambo guy like that?
Yeah.
Shoot him up.
Yeah, this person's name actually was Rambo. I thought that's what it was. I was going to ask you if it was that person.
Yep.
But anyway, so Scott, I would send him all the people that I would do all the workup, and they still felt like crap. And people want to be recognized. And when I say recognized, just like, hey, Bob, not that, but they want to be seen. That's probably a better term.
Okay.
And they want their problems to be recognized. And they would like a name to put it. We like to put names to things. So look at the sky. We've named every damn thing we can see in the sky.
Every star.
Right? It's something that humans do.
That's true.
We have to do that. We have to name everything. And people want their ailments named. And if I don't have a name for it, or if I do have a name, but they find out it's just a description of their symptoms, episodic abdominal pain, syndrome or something. I can't think of a better example than that, but, where it's just a description of the symptoms, it's not a name, then we don't have a complete understanding of it. It frustrates my patients, and for good reason. And I would send them to Scott, and he would check their 12 different pulses or whatever, and their humors and their chi or whatever. But he would have a name for what they had. And we didn't have a name for it. We should probably come up with some examples of things like that. But and they would come back to me and they would feel better. I'd already ruled out the stuff that could kill them.
Yes. And that's why I'd send them to you.
Yeah, and likewise, if Scott had somebody complaining of chest pain,
hey, Dr. State wants you to have a look at this,
which was great. So we were truly complementary in that regard, and that's my. I'm totally fine with complementary medicine. It's not really alternative medicine. I don't like that term as much, but we complemented each other because the things I was good at, and him not so much. Like pronouncing things like islet cells and stuff like that, and then and the things that I was no good at, he excelled in, and he could name these things that people had that we didn't have a name for, but traditional Chinese medicine did have a name for it, and he had treatments that he could do with them, and a lot of them, I believe, had a lot to do with distracting the central nervous system from using smaller pain to distract the central nervous system from larger pain, inducing those endorphins, those endogenous opioids that we mentioned earlier, and also just deep relaxation. Because when you go to Dr. Scott, of course, he has that deep, soothing voice, and he's real quiet. And he does his thing, and then turns out the lights and puts on the spa music, and then you lay in there for 20 minutes, and you attain a kind of an outworldly state of deep relaxation, which is good for anybody, So
it's pretty cool.
But anyway, so it's not bullshit. He absolutely helps people. I still send people to him to this day.
Oh yeah, shoot you.
So anyway,
good.
All right.
Good question, Stace.
Yep.
Hey, Dr. Steve, it's Mike from New York.
Hey, Mike.
I'm doing well. Hope you are.
Yeah,
too.
absolutely.
So, Casey, hi.
Okay, will do.
I was wondering, now if an individual has both their legs amputated, you have all that circulatory system, the veins, arteries, capillaries going down. What happens with those? Do they dry up and wither away, or after the wound is cauterized, are they just filled with a liquid forever? What's the deal with that? Also, the heart, now it doesn't have to work so hard because it doesn't have to pump blood all the way down to the feet and everything. Does it help give you more meaty tumescent erections because it has a better, smaller system to pump this blood into? Or does the heart just get lazy and say, I'm not going to do so much work? Thank you very much.
Hey, thank you. Those are both great questions. Let me answer the second.
Hey, Dr. Steve.
What's going on?
New York.
What the hell?
I'm doing well. Hope you are too.
Yeah, absolutely, man. Okay, we got it. Let me answer the second one first. When I moved to North Kakalaki from Michigan, I was a kid. I was used to playing outside all winter long, doing my paper route and all that stuff, 10 below, no big deal in the middle of winter. Came down to North Kakalaki. It was 32 degrees. People were coming in from the outside going, oh, it's so cold. It's so cold out here. And I was just laughing, saying, this is when we put on our light jackets. When it hits 32, this is awesome. But now, when it hits 32 here, I'm like, oh. So I got used to it, right? And the heart will do the same thing.
Yes.
In the beginning, maybe there might be some improvement, but after a while, it just goes, well, I don't have to, And the amount of resistance that you remove by removing legs, now you're usually removing them because of bad circulation, so it could be significant in that area, but overall really doesn't make that big of a difference. Now, to the first part, what happens to the vessels? Well, people think that the circulatory system, that the arteries go down and then they connect at the toes to the veins, and then the veins come back up. Okay? So if you cut the leg off, well, what the hell? You've got a blind end to the arteries, and you've got a blind end to the veins. How does the blood just pool in the leg? And it doesn't.
Sure.
So you know that your internal model, if that's your model of the circulatory system, it is incorrect.
Right.
So the correct model is that the arteries do pump away from the heart, but they link up with the venous system in multiple places on the way down in these plexus.
Stops,
and it makes these sort of plexus.
It's like a subway
networks.
system. It's like a New York subway system.
Yes, that's right. That's right.
Yeah.
And so that when you cut off those ends that were already under pressure, there was vascular remodeling that was being done so that the body could adjust for that. The circulatory system can remodel itself, and it does it based on stressors, and one of those being distal increased pressure, so that distal meaning closer to the feet. And so already before you cut that leg off, there was remodeling being done. And then those connections just reinforce themselves so that you have connections in the leg between the arterial side and the venous side that really weren't doing that much. But when you cut the leg off above the knee, for example, now those become crucial. And the arterial side will become larger and more muscular as you add more pressure to it, because now there's way more pressure going in those cross-linked arteries than there were before.
Right.
Because before they were in parallel, there was a little bit of blood going sideways, but a lot of blood going straight down. Now the blood is all going sideways, and but that doesn't take very long at all for the body to
because the heart compensates and backs off a little bit.
Yep, that too.
Yep.
Okay. There's new blood vessels can sprout off from the remaining vessels, and that's called angiogenesis as well. Okay, and angiogenesis is just where, due to pressure and stress and decreased circulation, that the body makes new blood vessels. So, unlike the central nervous system, where you're pretty much stuck with the cells that you were born with, although that's not 100% either. But more so than the vascular system. Yep.
Good question, man.
Excellent question.
Great question.
All right. Now, remember last time we talked about when I did streaking at UNC and we were on TV? My niece spent a bunch of money to get a press pass so that she could get access the archives of CBS News, and she found it. She found this news story. I can't show it to you on here. And we also can't just put it up on YouTube.
Sure.
But I can play it, and you can see my stupid self in this. And let's see.
It's called streaking. Last night, some 200. It seems to be a new craze on college campuses, making a dash through a public place in the nude. It's called streaking. And last night, some 208 male students at the University of North Carolina at Chapel Hill claimed that they made a world record streak.
And not only that, but it was Mangum Dormitory in Upper North Campus. So
at least 2,000 students and 4 campus policemen gathered to watch the young men streak by. The crowd, of course, is essential for a successful streak. One streaker said, "After all, what good is it if nobody sees you?" And that's the way it is. Thursday, February 28, 1974. This is Motor Crime Cabinet.
God, we did that in February?
Shrinkage.
Oh, my God.
Shrinkage.
Yeah, well, that gave you some excuse. But I told you the story that my group branched off from the other group, and we ended up all of a sudden in a crowd, and there were like 20 of us, and people were going to go, who the hell are those people? And let me tell you something, when all of a sudden you're in a crowd of people you don't know, and you're no longer running with 200 people, it's just you and like 10 people, and now you're dispersed in a crowd, all of a sudden you realize that you're naked. And I remember I took my tie that I was wearing. I had a Groucho Marx mask on, and I had lost it somewhere. And I had a tie on, and that was it. And so I took it off my neck and tried to wrap it around my waist so that, my jungle area wasn't quite as exposed. And then this girl that I kind of had the hots for, and that was in my speech class, runs up and says, "Oh, you guys were awesome." And it was humiliating, is basically what it was. It was just humiliating. So anyway, well, listen, thanks always go to Dr. Scott. Thanks, Dr. Scott. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, that Gould girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Eric Nagel, the Port Charlotte Horror, the Saratoga Skank, Roland Campos, Steve Tucci, sister of Chris, Sam Roberts, she who owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, the great Rob Bartlett, Casey's Wet T-Shirt, Carl's Deviated Septum, Vic's Fluids, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and Fez Watley, who supported this show, has never gone unappreciated. Listen to our Sirius XM show on the Faction Talk channel. Sirius XM Channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.